Good evening, everyone. Thank you for joining us. My name is Tawana Rivers. This is the 10K Project, and we are here again this week, or another week, with an amazing founder who is going to tell us all about what his organization is doing, what problem they're solving, what changes they're getting ready to make to the world. And so we thank you all for joining us. As you know, our founders, many of them cannot continue the good work that they are trying to do without capital. And so the main priority here at the Bet on Black pitches that we do here at the 10K Project is to allow these founders to get the awareness and the exposure that they need to help them get the capital that they need that allows them to keep their doors open longer, right? And see to the end of their project and realizing the dream that they have. And so we come in to assist in that area. So your job this evening is to pay close attention, right? We're going to show you how to do some of your due diligence. And so due diligence is important because you are deciding independently if you want to add this business to your portfolio. And so we thank you for joining us here. In addition to deciding if you want to add it to your portfolio, my call to action, spoiler alert, is going to ask you to share the heck out of this campaign when we're over. And so I hope you enjoy what you are getting ready to hear and see. So with that said, I am going to pull up the campaign page. We will be putting the campaign link in the chat as well as in the Facebook chat throughout the evening. So you don't have to worry about that, Antoine. That will be done for you. And that campaign link, as you know, is where the family members can go and invest if they are interested and see more about the campaign. So I'm going to share my screen. Apologize, turn that up. Welcome to everyone here in Zoom with us and everyone watching us live in the Facebook group. Welcome, welcome, and welcome. All right, so this campaign is on Net Capital. We don't visit Net Capital enough. So to the Net Capital team watching, we need you to get some more Black founders so we can visit you a lot because we don't come here often. So I'm going to spend a few extra moments just kind of going through the layout of the page because I want you guys to be very clear on where to find everything. And so the minimum investment in this particular campaign is $104. The deadline to invest is July 28th. So we've got almost exactly a month, right, to invest. The unit price is $8. Total amount raised already is $11,064. Antoine, what amount are you trying to raise? What's your max?
Yeah, so we're actually shooting for $1 million, and that was a valuation that we had kind of come across as we talked to a number of design and engineering firms to really kind of nail down what their perceived cost of actually building a device such as ours would cost. And so we've actually been operating under lean startup kind of principles, and we've been able to do a lot with very, very little resources, which I think is kind of indicative of our community as a whole. We're, given the least amount of resources, but are able to produce things that are competing with the likes of larger companies. So
yeah, unfortunately, that is a story we hear all too often. And so tonight we hope to help you change that narrative a bit. You can, on the campaign pages, for anybody who's watching us for the first time, it's important that you look at all of the information that the founders include on their campaign pages, because it's the information they know you need that tells you about their company. Because remember, most of these founders are not pitching anywhere, right? This campaign page is meant to tell the story. And so it has all of the information that you need to make a determination. So what you're getting here this evening is kind of the icing on the cake, right? Where you get to hear the founder himself talk about the project, and then you get to chime in and ask any question that you may want that can help you remove the barrier of entry. And so I'm just kind of scrolling through the campaign page so you can see how much information is here, right? And all of the information I want you to pay attention to. There are financials here. There's the SEC filing, which is called the Form C that is here. For those of you who have been with us for quite a while, you may remember we did a Form C training to kind of help you read through that document and understand what it was asking, what it was showing. And so all of that information is here. You've got the link, the website, all of the social profiles, all of that information is here to help you do some due diligence as you decide if you want this to fit in your portfolio, right? And so I recommend you look at this. If after this evening you walk away and you still have a few questions, every campaign page has a legal obligation to have a discussion section, right? It is a section where you, the potential investor, can ask the questions that you have, and then the founders respond back to you via that same discussion page so that anyone else looking at this campaign page can also see all of the questions that have been asked and answered, right? So with that said, I will stop sharing. And this is where I turn it over to you, Mr. Johnson, to tell us everything about what you're doing.
Well, thank you, Tawana. I appreciate the very lovely introduction. I will kind of reiterate it. I doubt that it'll be as grand as yours. So hello and welcome. My name is Antoine Johnson, he, him. I am the co-founder and CTO of LucyDx Co. Lucy being a derivative of the term lucid, as in bright or easy to understand. And DEX is actually short for diagnostics. So that is kind of hitting the nail on the head, so to speak, with the name of the company. We're actually a technology and wearable device company that is using light to detect diabetic retinopathy. And so I will share my screen with you. Let's get this show on the road. Can everybody see the presentation deck there? I see thumbs up. All right, great. All right, so our tagline is preventing blindness through early detection. I briefly mentioned that is for diabetic retinopathy. There are quite a few use cases that we can actually apply this technology to, but we're actually focusing on diabetic retinopathy first, as that is an affliction that I would say it affects and impacts the Black community more than I would say any other kind of afflictions in terms of visual acuity or sense of loss in terms of your senses. And so that's the main goal that we're trying to achieve. So our team actually consists of a vision expert who actually isn't shown here due to non-compete and some kind of non-compete agreements that are in place, but they are the inventor of the technology. Dr. Andreas Inman is an engineer with 20 plus years of experience in bringing medical device startups to fruition. And then there's myself, computer scientist and engineer with an expertise in data analysis, product development, and user experience. So that helps to build the team that is perfect to kind of develop this product and to bring it to market. So the company actually started out of the FedTech startup studio. If you're not aware of what FedTech is, it is an accelerator program that I highly suggest everybody look into. It is a fantastic program, and it aims to commercialize technology that is developed in a national laboratory. So When you think of national laboratories, you think of places like like Sandia or Los Alamos, or in our case, Veterans Affairs. And so we were selected after a very vigorous kind of investigation and background check into our published works to make sure that we had the skills that would match up to the demand of bringing this particular technology to market. Shortly after that, we participated in the Mass Challenge program, another fantastic program, as part of the Houston cohort of 2021. And we've also gone through the startup school via Y Combinator. It is where we were able to kind of build our network of advisors and mentors from all walks of life and industries, including the medical, university, and legal industries. So supplementing the experiences that we have on our team. So I will invite you to picture this particular scenario. And I say that this is a scenario that's kind of near and dear to my heart because it is a story that is something that my family members have actually personally experienced, and it kind of brings together everything that this company is about. So picture this, if you will. You're 46 years old, in the prime of your life, or so you think, and you happen to have been diagnosed with diabetes as a teen. You're not really keeping up with your medication, but you exercise, you eat reasonably healthy, with the occasional cookout, of course, and you work the night shift. One morning, you're driving home and you notice that you've got a little bit of blurriness in your vision. You kind of chalk it up to getting older and think nothing of it until that one time you accidentally curb check your new Mercedes. And that's actually happened to me, but we'll move on to that. But I would say that, you know, your spouse is going to have a field day with that, and they're going to implore you that you need to get a second opinion because that might not actually be just the subsequent getting older kind of symptom. So after a few weeks of kind of dealing with it, or I would say kind of pushing it off rather than dealing with it, you finally decide to take some time off of work and go to a primary care office. At that primary care office, they tell you that you need to see a specialist. So after, I would say, 3 months of waiting for the specialist to actually be available, you finally get the opportunity to go to the hospital, and you're stuck in a waiting room for 4 hours. Great. So after this 4-hour gauntlet, you finally get to see the ophthalmologist, and they bring you to this large room that is a dark room with a huge machine in the center, and they tell you to put your head into this machine. After about 15 minutes of bright flashes and hemming and hawing, the specialist finally comes to the conclusion that you're showing signs of diabetic retinopathy. So that blurriness that you were experiencing before is retinal damage, and your left eye is actually compensating for damage in your right eye. Unfortunately, that damage is much worse than you thought, and you're actually going blind. So now your only options are highly invasive either way. You get drugs injected directly into your eyeballs. Nobody wants that because that's literally sticking a needle in your eye. Or you're undergoing laser surgery that will destroy part of your retina. Even worse, those treatments aren't actually going to help slow the progression of the disease. It can't actually be cured. So your vision loss is permanent. And so this is unfortunately a story that I kind of resonate with. It resonates with me in particular because a family member had experienced this, but it's not a unique story. This is something that I would say 7.6 million Americans have experienced just this year alone. I say experience because that number is going up every year. And that is a diagnosis of diabetic retinopathy. So although diabetes affects approximately 35 million Americans, DR, or diagnosing diabetic retinopathy, actually faces challenges of time, money, the availability of care because you have to go see a specialist, and most of all, patient compliance. And now this is that market fit that we're all hoping to find, right? There's always a need, and then you kind of have to build towards that need, right? And so right now, you can only be diagnosed by an ophthalmologist or an optician. So you see that I have glasses. Most people actually don't wear glasses, so they're not going to have that annual visit to the eye doctor. Thus, they're missing out on that potential diagnosis. And then again, if you do have diabetes, you might actually fall into that 37% of diabetics who don't actually go to that annual exam or that checkup because it requires a specialist. And so up until that point, that damage is occurring, and it's irreversible damage, right? That vision loss will have already started, and you can't do anything about it. So we actually did some research, and there was a study that was done by Johns Hopkins that showed that blindness was the #1 fear among Americans in terms of losing one of their senses. So of all the senses and all the afflictions that you could kind of be encumbered with, that includes hearing, losing your memory, losing speech, losing your sense of taste and smell, thank you, COVID, or even losing a limb. So there's this huge demand for and a growing population of desperate people that are looking for a solution that will kind of help prevent that vision loss from occurring, and will allow them to get that kind of diagnosis without actually going to set up a separate eye exam or seeing a specialist. So there are two types of diabetic retinopathy. There's the non-proliferative, and then there's the proliferative. Non-proliferative is the early stages of the disease, and the proliferative is the advanced stages. So like I was mentioning before, when you get a diagnosis of diabetic retinopathy, it is in these later stages. It is in the proliferative advanced form. So you're not seeing any kind of symptoms. You're not seeing visual aberrations. If you do go to an eye exam, what they'll see is they'll actually say that it's a microaneurysm. And so those microaneurysms are caused by tiny swelling of the blood vessels in your retina. And this over time becomes large sections of blood vessels. And that's the thing that they'll actually see. So of these 422 million people with diabetes, 145 million of them have some form of diabetic retinopathy. And of that 145 million, 45 million have proliferative diabetic retinopathy. So they're already starting to experience the vision loss. They're already losing their sight. And so that brings us to our solution. So we are building technology that is an early detection solution that can diagnose and allow a doctor or physician to manage the treatment of that diabetic retinopathy before the visual damage occurs. So it is, as you can see in this image, a goggle headset, and the headset actually flashes a light into the wearer's eyes. It has integrated electrodes that are really detecting the neurological responses of the flashes. And so essentially, it's if you're familiar with the standard protocol for detecting diabetic retinopathy, they use two main solutions. One is called OCT, and the other is fundus photography. And both of those actually use some kind of light to look into the eye, but it doesn't, it only looks at the damage that's already occurred. Our device is something that is preemptive to that physical damage, and it tracks that neurological response. So before that damage has occurred, which actually kind of changes the entire paradigm of diagnosing diabetic retinopathy. So we have built-in software that automatically interprets these responses, and the test actually takes less than 10 minutes. It doesn't require a large machine or a large dark adaptation room or time period or dilation for that matter. And best of all, it doesn't actually require any specialized training. So we can take this technology out of the hands of a specialist and put it into a technician or somebody who is running the front office, and they are more than capable of actually running these tests and submitting the results, as they don't have to interpret the results. So there's no kind of gray area or ambiguity in terms of whether or not you have diabetic retinopathy. It's a direct reading. And so again, this kind of changes that whole paradigm of, okay, well, you're going to get your eye exam and then you're told retroactively that you're going blind. This changes that. So you're not going to go blind. And that's the whole point of this particular project, is we want to prevent blindness through this intervention, or through the ability to intervene prior to that damage occurring. And so recent studies have actually revealed that during these early stages, the non-proliferative stages of diabetic retinopathy, using this type of device will actually intervene and prevent that vision loss from occurring. So this slide here is kind of a primer of the output that the technology allows. On the left side, graphs A and C, we have there's kind of like the baseline ERG reading, and graphs B and D are how we're presenting the technology currently. And there's a bit of decomposition that takes place to actually get that signal that you're seeing on the lower part of the graph. But essentially, there is three main waves that are responsible for your vision. There's the A wave, the B wave, and then there's like something that's called an OP response, right? And so our technology actually detects the delay of these OP responses. And so if you see in graph B, there are four different peaks and troughs that we've identified there. And that is actually, we're measuring the period between those different wave responses, or those signals that are being interpreted by your brain, essentially. And so below the graphs, there is a study that we have linked. It is the novel detection and restorative levodopa treatment for preclinical diabetic retinopathy. That is the main basis for this technology. And this is actually a new biomarker. So again, it kind of changes the entire paradigm of how DR is diagnosed. The intellectual property that we're building, again, is a headset. We do have a PCT application that is active currently under devices, systems, and methods for performing electroretinography. It was submitted by our inventor, who's part of the Veterans Affairs and Georgia Tech. But there is actually an ongoing collaboration with these institutions to develop follow-up clinical trials. So this is an ongoing effort that we're undergoing in terms of developing grants and follow-up clinical trials. And that brings us to the business model. So our again, we have FDA approval process that we believe that we'll be able to get through when we start actually developing the device for the masses. And there is a predicate device available. So we're going to go through something that's called the 510K process, which is a little bit less stringent than building a device from the ground up and then having to go through that FDA process. As you know, it's very restrictive. And we have actually identified a CPT code that means that we are going to be Medicare eligible when we're able to provide this product to the market. So we're actually going to start our early adopter program. And this is comprised of key opinion leaders and stakeholders and specialists, so ophthalmologists that have many decades in the field and are really advocates for new technology and are able to kind of bring this into their environments so we can run usability and feasibility tests. We're exploring different business models. So one that comes to mind is the direct to sales or direct to consumer. And I think this is going to be something that is a little bit further down the road because, again, we want to really develop the specialist hardware first so that we can bring in these opinion leaders and have them be the influencers for the physicians and primary care offices. And we're also kind of exploring this razor and blades model. And so what we mean by razor and blades is we have we believe there's a virtuous cycle essentially between those high margin, low volume device sales of medical devices and the low margin, high volume single use sales. So components such as the goggle gaskets, the head straps, those things are going to be detachable and actually make it so that it ensures a quick and easy sanitation between device uses. And so our competition is, I would say they're a bit lacking at this point. Again, this is a paradigm shift in how DR is diagnosed. And so there aren't really too many corollary companies that follow this kind of model or have this capability. And so it kind of lends us to be able to experiment with, again, the usability and being able to build this device to fit in the environment that it's most relevant and most needed. And so not only is our solution the only one that detects DR early enough to prevent that kind of loss, but it works in almost every category that a primary care physician would care about. So if you go down the list, being able to prevent that damage, being in that primary care setting, you're not needing a specialist or somebody with specialized training. It literally takes less than 10 minutes to perform that test. You don't need a huge dark adaptation room or 10 minutes for dilation or dark adaptation for your eyes. And it's a one-step sanitation process. So it's something that lends itself to folks that don't necessarily have those resources or primary care offices. So the market that we've identified is a new product category within the point of care devices market. And so this is at the intersection of two substantial trends. So the first trend being the growth in the diabetic population that we kind of briefly mentioned earlier. There's a demand for increased preventative care. And then the second is this shift into a model that non-physician can actually perform this test. And it was previously that these types of tests were only performed by specialist doctors. So again, we're a really disruptive substitute for things like fundus photography and OCT. So that leads to improved patient outcomes and a lower time investment overall. So to briefly kind of summarize the traction that we've had thus far, again, we've confirmed that there is an existing reimbursement code. So it is going to be Medicare eligible when this hits the market. We had early success in the Mass Challenge program. This is kind of bootstrapped the prototype phase. And so we were able to build both non-functional and functional prototypes. And we're moving into the mode of scaling those up so that we can really engage our early adopter program. We're working with researchers at various institutions and academic institutions as well. So being able to run those follow-up clinical trials to have the usability and feasibility studies done and performed, and then to eventually kind of graduate that onto more specialists. And then we've completed the licensing of the technology. So we actually have the exclusive rights to this technology. So that puts us in a pretty unique position, I think. And then so we've undergone these feasibility prototype development phase, and this has been based on the licensed technology as it is. And so again, we're using this campaign to move from this early I'd say pre-production phase into more of a precursor to the manufacturing phase. And that will actually conclude my presentation. I want to thank everybody that joined and leave it open for any questions.
Wonderful, Antoine. Thank you so very much. You want to stop sharing your screen so we can get bigger on the screen. Guys, if you've got any questions, please go ahead and put them in the Q&A. I've got a few to get us started. So first of all, thank you so much for such a wonderful presentation. And even more than that, thank you guys for developing something like this. I mean, this is absolutely huge. And to see your comparisons and how much more your device does than the competition that's already out there, absolutely wonderful. I wanted to get a couple of clarifying points because, you know, as we know, I too am a potential investor, right? And so I want to make sure I'm clear. So you had mentioned that you had the exclusive rights and licensing from the government. And then there was another slide that referenced something called PCT. Help us understand that a little bit more. You know, we're used to hearing terms like we've got the patent, right?
Right, yeah.
Tell us how this is different than that or how this is like that.
Right. So ERG is a standard protocol that's been in use for, I'd say, like 50 some odd years. The thing that is novel is the biomarker that's identified that we're actually using as the determination for whether or not you have diabetic retinopathy, and then B, the form factor. So I see there's a question there that this is a good segue for. Who are your competitors? So there, the predicate device, there is something called a Redival, and it is a headset that, or it's not a headset, it's a handheld device that does a number of things marginally well. We're really focusing on doing one thing the best. And so that is miniaturizing this ERG in this form factor, and then delivering a result that is not a visual slash ambiguous kind of result that has to be interpreted by a specialist. So it takes the guesswork out of whether or not you have diabetic retinopathy, again, because if you're in this non-proliferative state, you're not going to show any symptoms, so you're not going to get that diagnosis.
Very good.
And to go back to your previous question, the PCT is a patent application. It's mostly for European countries, because again, this standard of care actually exists, so that couldn't be patented directly. But the form factor and the biomarkers are what we're focusing on.
Okay, very good. And the other thing, can we talk a little bit about the price point? So what does or what will this device cost? Who is the customer, right? So is it the individual with the retinopathy issue? Is it a doctor's office? Like who's the, so those are my two questions, price point
Right.
and who's the customer?
Yeah, so we're still experimenting with the price point. I mean, the whole goal of this company is to lower that threshold so that we can make the technology more readily available, and more specifically for folks that don't necessarily have those types of resources to throw at new devices or devices that cost thousands and thousands of dollars. And so our price point is, I would say, less than $10,000. I would even venture to say it's probably in the hundreds of dollars. So we're really experimenting with our manufacturing methods, the components that we're using, where they can be sourced, so that we can make sure that we can drive that price point down and increase that availability.
Okay. So will this be treated, and if you're still working with the price point, you may not know the answer to this question yet, but will this be treated like durable medical equipment, or, something that I have to get a prescription for? The insurance more than likely will cover it if you have a CPT code, so that's good news. Yep. So that's how this would go. I wouldn't walk into a store and buy this for myself.
Not at this point, at least in the early stages. Again, we want to focus on kind of bringing in the experts that have familiarity with these types of devices and with this particular standard of diagnosing diabetic retinopathy. And so we're, again, kind of leveraging their expertise to refine the design and the function. And then once we can bring that price point down, then we'll start building various versions of it. So again, we kind of envisioned like a really low cost version that, again, does one thing really well, and it doesn't have all the bells and whistles, but we're focusing on the headset that we can deliver to a specialist, and they can make different tweaks to it that can refine and optimize its use in their particular setting.
Okay, very, very good. And then my final question for the moment is, it is not only detecting, it's preventing as well, right? So I just want to make sure I understood that clearly.
So the prevention is in being able to intervene before the damage occurs. Okay. So yeah, so it's essentially the way that you detect diabetic retinopathy currently is you look into your eyes and you see the damage that's already occurred. This preempts that damage.
Completely understand. Okay, thank you so very much. Let's get to the questions from the community. Sarah said, is it that 37% of diabetics won't go to an annual eye exam, or is there some other factor influencing their inability to go?
Yeah, so the factors that influence that ability are, again, the time constraints. So you have to go to a specialist, which means you have to book that time with that specialist. And as you know, during COVID, there's been an increase in that demand. So the amount of time that you're having to wait to go see a specialist is actually increased. There's the influence of money. So usually these devices are very large, and there's a lot of R&D that's kind of built into it. So the cost is pretty much out of the range of what a layperson or normal folk would be able to afford. So you'd have to go to a specialist hospital in order to get those types of devices to actually see those devices in use. And then there's also, again, the availability of care. So because you're going to see a specialist, there's less of them and there's more patients. So again, it's kind of a confounding factor there.
Very good. Brandy said, excellent presentation. And she has a question. Have any device risk been identified?
Yes. And so again, we're going through this 510K process. And so there's a predicate device that is actually on the market. We kind of use that as like the example of what not to do, essentially. But yes, we're taking all of these kind of risks and under advisement, and really making sure that we're building something that's safe and compliant and is able to be put into these different environments. Remember that the key of this device is increasing its availability. So we want to make it as safe as possible.
So what are some of those risks that you've identified, obviously not with your device, but with some of these other devices? What are the potential risks that you want to avoid when you build yours?
Yeah, so again, we're making it really, really simple. So the predicate device has a lot of bells and whistles that allow you to modify the different waveforms or the actual outputs that are being delivered. And so you still have to kind of do a fair amount of tweaking and training in order to use those devices. Our device being so simple means that there isn't that huge ramp up time to learn how to use it. Somebody that really isn't in that specialist world can actually apply and run the tests, and then the result that is actually conveyed to that user is something that doesn't have to be interpreted.
Very good. Thank you so much for that. Tammy has a question. She said the device looks like the metaverse Oculus for VR. Will that be a problem in the future? So let's talk a little bit about the design.
Yeah, so again, the exclusive right that we have is for the form factor of this device. So miniaturizing this ERG into this headset form factor. But then also, I would say it's also it really kind of it's a matter of, I'm sorry, repeat the question again, please.
Absolutely. I know something popped on your screen and distracted you. I hate when that
Yeah.
happens. I know. Absolutely. So the question was the design of the device and the fact that it resembles the Oculus.
Yes.
So
So
do you think that could be some kind of infringement problem?
oh, okay. So yeah. So where I was going with this is that no, it doesn't, because we have the exclusive right for that particular form factor. And then there is the possibility of leveraging these Oculuses and these other wearable headsets to essentially have a component that attaches to those other devices. So yeah, it's not of a concern for us. In fact, it's something that we're totally leveraging.
I like that. So what I'm hearing is this could be an accessory to the devices that are already out there, which minimizes your time and cost to build from scratch, right?
Absolutely.
That's actually pretty smart, sir. Very good. Because there are a lot of those types of VR glasses out there, right? Oculus is just one. There's so many types, so many designs. So that's very, very, very good. Very great idea.
Thank you.
Brandy said, Medicare will cover some investigational device costs. Is the device currently reimbursable under Medicare in your current trials?
Yes, yes. So there is a CPT code that exists for preventative care, and it includes the ERG that is in this particular headset.
Very good. Tammy said, do you see a future where photos of the retina will be possible with the device?
Ooh, so we have explored that possibility, and yes, it does exist. Again, because we're using the ERG technology, it doesn't require a camera, so we're actually able to mitigate some of the cost of the unit by excluding that. But there is a possibility of another device or another version of the device that includes that functionality.
Very good. Brandy said, it seems the MD or optometrist would not be required to administer the test, but would need to interpret the results, similar to an ECG. So is that accurate?
Yes and no. So that's part of what we're building at LucyDx. We're building the models and the actual result experience so that it doesn't have to be interpreted. You actually get a direct yay or nay result.
Very good. Very good. Tammy said brilliant. Simply brilliant.
Thank
Sarah
you. Thank
has
you.
a question. As part of your adoption outreach, are you planning to partner with medical schools, specifically HBCUs?
Absolutely, absolutely. If you have any contacts, please send them my way. I would absolutely love to chat with them and get them involved. Again, we're building this early adopter program to get that actionable feedback, and we're really kind of working up to building a database that can be shared across the different devices that we're really trying to build this for. So yeah, if you have that kind of connection, please by all means send them my way.
Very nice. I have another question. If money was not it wasn't a problem, right? You had the $1 million you needed, right?
Mhm.
How long could you get to market? How long would it take to get to
Ooh,
market?
I would say that is the main constraint for that would probably be the 510K certification process. Uh, Outside of that, we have a number of like I said, functional and non-functional versions that we've already developed, and so it's really a matter of being able to lower that price point so that we can increase the availability of the device, and then make sure that we're staying compliant with all of the regulations.
Nice. Brandy suggested to also partner with some federally qualified healthcare centers.
Yes, yeah, absolutely. Yeah, we're looking at private healthcare, federally funded healthcare, you name it. So yeah, if there's an opportunity for us to connect with diabetic educators or ophthalmologists or specialists, then we're absolutely undertaking that as well.
Good. Sarah said, regarding the CPT code, how might you handle changes in the Medicare system where this testing is no longer part of preventive care?
Ooh, that's a good one. So I think that is something that we're definitely having to mitigate. There's always changes to the laws, but I say that the device that we're building, we feel is because it is a predicate device. We're really trying to drive that price down so that it's not it isn't precluding anybody from using that type of device or using the results that they gain or the insights that they gain from that device. And so, like I mentioned before, there is the possibility of a direct to consumer kind of strategy. And so that would be something that would lend itself to.
Very good. Edward is saying in the chat that Bison Ventures would be a good connection. So Bison Ventures is a VC fund headed by Gary Johnson is the CEO, and I'd love to make that introduction.
Oh, that's fantastic. I love it. Thank you.
Yeah, thank you so much for that, Edward. That was a wonderful reminder. Any additional questions for Antoine? This has been a wonderful presentation, very, very thorough, very informative. Thank you for that.
Yeah, like I said, this is a passion project of mine, and it's something that is very near and dear to my heart. Again, probably for selfish reasons, because it affects my family members, but it's something that I feel that we can actually accomplish, and it's not out of the realm of possibility. So if I need to shift some things around, that's just what's going to happen.
Very good, very good. While the community is deciding if they've got any final questions, I want to ask you my final question. Why was it important to come to the 10K project tonight?
Yeah, so I don't want to sound like like I'm rehashing sound bites, but representation absolutely matters. Having the visibility of Black founders and having a platform such as this is something that I don't necessarily feel that we should want, but we need it. And so I'm really kind of putting my money where my mouth is, so to speak, and being more than just a backseat evangelist. I'm really taking it on and participating in this community. So
we definitely appreciate that, and we definitely need more spaces like this, right? And we need more founders like you and Andreas to really lean into equity crowdfunding, right? We know that it is absolutely a game changer, but we also know it takes a whole lot of time to raise capital this way. And so I am always very appreciative of founders that take the extra time to do it this way, because we know it's a lot more work, but we are very appreciative of the opportunity to get in, that early seat at the table. So thank you both for that. And we've got questions that popped in. Beulah says, Tennessee State has a 3-in-1 program with Meharry Medical School. Fisk has a successful space program with NASA. So I think she's recommending that those may be places where you kind of reach out.
Oh yeah, absolutely. We're definitely going to look into those. And we've actually looked at some of the space programs. There's a program that was in partnership with MedTech, actually, and we didn't go that route because at the time they had some kind of restrictions to what tests they were allowing in space, and it provided the opportunity to essentially send your units to the space station, to the ISS, and have those tests run in that type of environment. But because we are a medical device, it has to be connected to an individual, and that kind of precluded us from participating. So, but yeah, we'll definitely look into those programs. Thank you.
Nice. I love this community because as much as we receive, right, in the opportunity to invest, we give back equally as much. There has never been a session where this community hasn't said, check out these people. Here's a connection. Like, I love the 10K Project community with my whole entire heart. And Tammy said, don't forget the mobile phlebotomist business owners. They go out to homes and obtain blood work. This device could be an extra stream of revenue for them and increase the compliance rate for doctor visits for the patient. Wonderful idea.
Yes, absolutely. Yeah, we actually looked into that because of the corollaries it has to an EKG or an ECG, where you can wear like an iWatch or was it the Ouya ring, which is basically a medical device ring that takes those types of measurements, and then you can deliver that readout to your physician. So yeah, that's absolutely something that we're looking into.
Nice. And Brandy says, as a clinical research professional and patient advocate, this is amazing.
Well, thank you. I'd love to take the credit for that, but yeah, this is something that I was selected in a pool of very qualified folks, and it just so happened that my expertise met with that opportunity, and so now this is something that I've devoted a significant amount of time in. So yeah, thank you.
Wonderful. Sarah said, apologies if I missed this, but if GE, Philips, Johnson & Johnson, etc., come knocking, is acquisition your exit strategy? So let's talk about that. What is the company's exit strategy?
So we're actually building this device, and I kind of teased it a little bit before, where it could be kind of applied as an attachment to a pre-existing headset. But in my experiences in the gaming industry, we've actually seen an increase in this type of biometric data. And so one of the things that we're looking at is building not a marketplace, but a larger repository of this type of data. So there isn't really a set repository for ERG. And that type of data is something that we feel has value and can be coupled with a lot of other types of biometric data. So the EKG, the actual visual data that is obtained from those headsets when they're doing eye tracking, for example. And so this is something that I feel like is it hasn't really met that that kind of fevered pitch yet, that network effect, but that's something that we're working towards. So an acquisition, I'd be dubious at that kind of exit strategy, but I wouldn't take it off the table entirely.
Good answer. Very, very good. Very, very good. Any additional questions for Antoine before we give our closing statements? Give it a few seconds. Sarah said Apple actually might be a major player given their investment into health.
Yes, we've looked at a couple of Apple-based platforms that are integrating health data, and so again, that's not off the table.
Yeah. It's a whole lot of stuff on this table, and that's how it should be.
Everybody's got to eat, so
that's right. That's right. Well, this is wonderful. As the community is deciding if they have any additional questions, I'm going to give my final statements. The campaign is on Net Capital. We've been putting the campaign link in the chat. Minimum was $104, if I'm not mistaken. Yes. So a nice, a nice affordable minimum. The campaign deadline is July 28th. So we have a month and 1 day, I think, right? Or just about a month.
Yep.
And so, what we always say to the community is, even though there's time left in the campaign, if this is something you believe you want to put in your portfolio, please do your due diligence and invest as soon as possible. At any point in time, this team can have someone come, right? Edward just told me to hook him up with a VC. So at any point in time, they can come and get the monies they are needing, right? And so we always want to be mindful of that. when we're thinking about how we move and how fast we move. You know, we want to be healthy, responsible investors. Antoine and Andreas do not want you calling them at 3 o'clock in the morning talking about, can I have my $104 back, right? So you want to be certain and make sure that you do your due diligence to make sure this fits in your portfolio. But once you do that, once you make that independent decision, we don't want you to delay just in case the funds that are needed get infused into this campaign, which is what we would all love to happen for the team, right? So please, please, please do your due diligence, consider investing. But you guys know what I'm going to ask next. Share, 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 right? The campaign needs more eyes on it, right? And so we saw $11,000 has been infused in the campaign so far. They're trying to get much more than that. They need our help to share the heck out of this campaign, share it with the people that you know. You know, the thing I love about this type of project is it does not discriminate, right? We saw the numbers, we saw the stats, right? 145 million, like this is a big market, it affects a lot of people, and it can save a lot of families from having the anxiety around potentially losing their vision. If you remember the one slide that he had up with the beautiful family, and then you saw the second picture and the vision was distorted. And so he couldn't even see his baby boy, right? In the picture, whoever, you know, that broke my heart to see that picture. It was like, oh, wait a minute, I get what I'm seeing here, right? Imagine a world where you couldn't see your entire family in one frame, right? Where you couldn't see the things you needed to see for daily living. You couldn't see this computer screen clearly to watch us here. Like, think about all of those people and how their lives are affected. And when we think about that from an investment standpoint, right? You know, the target market is definitely is there. And this is not an American issue, right? This is a worldwide issue. And so also, when you think about global solutions to problems, that you know needs to be taken into consideration from an investment standpoint as well. And so, you know, please consider that, but share the heck out of this campaign as much as you share the others, and even more, and share this with people that you know who have this problem, right? You know, what a wonderful world it would be if doctors started advocating for this, right? If this team started getting calls from physicians saying, I heard you've got this solution, right, to this problem. We want to help you get it to market faster. So just start talking about it. Just even outside of sharing the link, start talking about it to your friends and your family. Let's really get that word out there that this exists in a more complete form, right? Because we did see that it has some competition already, but this one definitely focuses in on the problem and allows us to get that early detection and early prevention.
Absolutely.
And more
And
questions popped in too. Go ahead. What were you gonna say?
oh yeah, I'd just like to add to that offering page. So all of that has actually been driven organically. That we had zero marketing. Again, I have a day job. Andreas has a day job. So this is something that people have kind of found on their own. And so any kind of marketing capabilities or you know, sharing it with your networks, that is something that is much appreciated, especially with our very limited networks. As I kind of mentioned earlier, my background is in the gaming industry, and so I was pretty much riddled with non-competes and non-disclosures my entire career. So there's very, very limited things that I can talk about that are, you know, relevant to my work in the gaming industry, but more specifically in terms of augmented and mixed and virtual reality, of which I have quite a bit of experience in developing. So
very good. Ms. Patrice says, how big are the actual device within the headset?
yeah, so the the non-functional or the functional the functional prototype that we've developed now actually uses an existing I'd say black box to make sure that we can miniaturize it into that particular form factor. But the potential device that we're developing and will come to market is going to be something that's much more refined and again does that one thing very, very well. So it probably won't look exactly the same way it does now. In fact, it most definitely won't look the same way.
Yeah, very, very few inventions look the same way the first design was showing it, right?
Right. Yep.
Miss Patrice says, I came in late. Did I hear him mention a European version?
No. So the PCT application was filed in Europe, but it is going to be marketed in the US first.
And then Brandy says, as an investor, how would we determine our potential ROI?
Ooh, that's a good one. So that's usually a question that I would kind of fork over to Andreas, as he's the operating president or the operations president. But I would say that the ROI is kind of based on the TAMSAM SOM calculations that we've had for the current market, and so that the addressable market that we've got is that's I believe we calculated as 1% of the US market in terms of diabetes or diabetic retinopathy related diagnoses. So it'd be a part of that market.
And then just also to add, so the Form C that's on file on the site should talk about how many shares are being offered, right? We saw that they were $8 a share, I believe is what the campaign page said. And then the valuation was $8 million. I forget if I'm recalling what we looked at earlier, but I think it's 8 million. So yes. You also should be able to figure you should be able to figure out what the shares that are offered are worth. And then depending on how many of those shares you're interested in buying with your investment, right? Or securing with your investment, then that'll give you an idea as well.
Right. Yeah. Being a medical device company, I'm pretty much restricted in what I can talk about in terms of terms, but I would absolutely refer to that net capital page, that offering page for those details. And yeah, those can absolutely be derived from that.
And I knew you couldn't say it. That's why I did, Antoine.
Yeah. Thank you. Thank you. Good looking out.
Oh, goodness. Any other questions before we let Antoine give his final statement for the evening? Okay, sir. We'll let you close it out. Thank you again.
All right, so I would like to again thank the 10K Project for providing this opportunity to have this kind of platform and to be able to speak directly to this community. Again, this is something that I'm definitely an advocate for and have been since the early years of my development. You know, growing up in Europe and being an Air Force brat, you really get a sense of American kind of exceptionalism, but I wouldn't say exceptionalism. I'd say more like the understanding that being an American in a foreign land gives you the opportunity to expand your perspective. And with that expanded perspective, I've actually grown to appreciate and love you know, my background being of mixed race and being an American. It's something that I really take seriously, and being able to communicate to this community is something that I don't take for granted at all. So thank you again.
Well, very, very good. Congratulations in advance on all of your success. What you have here, I agree, is absolutely amazing. Thank you for presenting it here to us. And and just so excited again about the lives you're going to change. I'm always taken aback when the founders that come here are truly changing lives. It's one thing to offer a cool service or a cool product, right? That's one thing, right? But to truly change a life, it's wonderful work that you're doing. So,
Thank you. Thank you.
we will continue to keep you in our prayers for success. We're going to make as many connections as we know how to make, right? And we're going to share the heck out of this campaign and obviously consider adding it to our portfolios as well. And so, continue going, don't give up, right? Don't let the lack of capital be the reason. We see that way too often. And so just keep pushing ahead and keep finding the tribes that are going to help you get there. And so you found one in us, and we're not going anywhere. So anytime you need anything, you feel free to call and say, hey, Tawana, do you happen to have this type of person in your network? I'd love to, have this conversation. And that's what we want you to utilize for us as well. So we're here to help you the whole way through.
Absolutely. I will definitely leverage this community to the fullest and make sure that we're lifting each other up too, because this is a two-way street. So
wonderful. Well, thank you, sir. You have a wonderful evening. Thank you to the community for coming out yet again and helping your girl out and supporting the Black founders. To everybody watching on Facebook, why y'all not in here with Zoom with us? Come on in Zoom.
Don't be shy.
That's right. Don't be shy. But we love that you're watching us, and we will see you all next time. Thank you. Bye.